a social good as well as an economic good. And the protection and sustainability of water resources is amongst the most pressing issues facing governments, communities today, particularly so in the water scarce areas. This is why the Gambia government continues to render all possible support to the provision of water of these basic services.
The two-day interactive exercise witnessed a healthy dialogue on an array of topics, all but for the strengthening and coordination of quality water and sanitation service delivery in the country. Anna Hafner of the Department of Water Resources has more on some of the topics discussed.
This is the first biannual meeting. What we will be discussing will be on the terms of reference of this group. We also want to look at a harmonized data collection tool that will be used by both sectors to report on water and sanitation. So basically these are the things. We also want to have a budget line to see that these are the things that we want to do and this is what it will cost, and then we'll forge ahead and see how best we'll be able to get all these funds to see that all our activities are implemented.
See how best we can harmonize and ensure that as we live here, we would move away from meetings of planning to implementation on the ground and ensuring that the data that we all collect would be harmonized so that it would assist us in the planning and implementation of future.
Members of the working group, the government and the international organizations were all adequately represented at the convergence. A scenario depicting the need for concerted efforts to actualizing the water sector project goals. Again, Anna Hafner seemed convinced that brains behind the alliance have what it takes to bring quality service delivery in water and sanitation.
All the brains are mature, they are effective and they are capable. Because if they were not, at least we have government institutions, we have the private sector, we have the NGOs, we have the international organizations. So all these groups and institutions are very much effective. And I'm sure all the brains that are in these institutions know why they are there and they are capable of doing what they want to do.
As the National Water and Sanitation Working Group and partners intensify the campaign for quality service delivery on water and sanitation, the Ministry of Water Resources remains hopeful that the goals are attainable, especially when relevant documents such as the National Water Policy and the Water and Sanitation Strategy Tool are adopted for enhanced coordination of activities. Louis Mendy, GRTS.
The 2014 edition of the International Roots Homecoming Festival begins on Sunday, but the trickle of guests has started. Jamaican artists, scratchlers, and a member of reggae star Sizzla Kalonji's band jetted into the country on Wednesday evening. We hope to bring you that story in our tomorrow's news bulletin. The Bansang Hospital Vision Center has been inaugurated. The initiative was funded by the One Sight Project, a charitable organization based in the USA. Ominjoy witnessed the ceremony, and this is her report.
Rural communities has received a massive boost with the opening of an eye care center at the Bansang Hospital. The Gambia has seen a significant advancement in the area of sight prevention methods. However, there are challenges that still remain to be addressed, particularly with regards to the affordability of a pair of glasses when prescribed by doctors. Well, the One Sight Project, an organization based in the United States of America, has been collaborating with the CSZ Regional Eye Care Office since 2009, and the partnership has yielded dividend. The project has opened an eyeglasses manufacturing laboratory at the CSZ Regional Eye Care Office, which is managed by trained Gambians.
We will give you the necessary support because you have come to rescue us from things that we could have spent a lot of money to have access. If that access is brought to us at the doorstep, at our doorstep, we will make sure that the program is a success and it will be taken care of.
The latest move by the project is the opening of a fully equipped vision center at the Bansang Hospital, where people with sight problems can be diagnosed and given suitable eyeglasses that matches their sight at affordable cost.
With the establishment of a vision center in Bansang Hospital, people of this region can now have access to quality and affordable optical services. This means people of CRR and beyond no longer need to travel all the way to Banjul just to get a pair of prescribed glasses known as lenses. This development will undoubtedly save us money, time, and great inconvenience associated with seeking services far away from home.
One side, the National Eye Health Plan and the Ministry of Health began their partnership back in 2009 with the goal of eradicating preventable blindness in the Gambia. As these speakers before me spoke about, there's been a lot of work in the Gambia by Sightsavers International treating cataracts, trachoma, and other medical conditions of the eye, but we've been lacking in uncorrected refractive error.
The Vision Center is expected to help in reducing the number of people with affected eyesight, thereby ensuring a healthier population. The center will also not only serve the people of Upper River region, but as far as neighboring communities in the Casamas, who often use the Bansang Hospital for treatment.
We wanted to help the people of a country help their own people and provide them with access to quality health care. Not just a pair of glasses, but access to a pair of glasses whenever they need it. And the country we chose to do this in was the Gambia for many reasons. The first reason was that the need was there. There were not many doctors or optometrists for a population of 1.8 million people. There were many hospitals that had eye units which we could work with in order to create these new vision centers.
The vision of providing comprehensive eye health services and ensuring that these services are accessible, available, and affordable, and are at the doorsteps of our patients and clients has gathered significant momentum over recent years. Ministry of Health and Social Welfare will work closely and collaborate with one side in ensuring that the Memorandum of Understanding signed in November 2013 is fully implemented in Indonesia.
With the commencement of the eyeglass manufacturing lab with trained personnel and vision center in the country, one could hope that the rate of loss of sight will drastically reduce in the region. Uminjai, GRTS.
Well, time now to take our first break. The news continues momentarily.
Gambia, Damane, Benchum Reume Ote, the Gambia Radio and Television Services, GRTS. GRTS Staff Association, Italy. His Excellency the President, Chair Professor Al-Haji Dr. Yahya AJJ Jame, no fast Kane Sumbu, Tinkalum Banquet Dinner, a grand dance with a difference. Bufikeja Amsufi Muse Amsach, on the 23rd of May, and on the 24th of May 2014, Stati Penchami Hall, featuring the now happening Queen of Malach, Titi Safnepa, Titi, Tamane Titi, Pare Rajahe Penchami Hall. You've never seen her on stage like this before. Titi, by popular demand. Joy Mostoli, Anak Aindanan artist Fiji Reumi. Tickets, Gala, Platinum, $60,000 Diamond, $50,000 Gold, $40,000 and the individual, $1,000 Grand dance ticket, $500 and $300 flat. For all reservations, please call 991-1992-365-5518 203-1850-682-9536. Sunyureu, Gambia.
Welcome back, and over now to the internationals. The US and Europe have offered to help Nigeria locate and rescue the over 200 girls kidnapped by the militant Islamist group Boko Haram. Nigerian police have meanwhile announced a reward of $300,000 for credible information leading to the location of the girls. The offer comes after news of a second kidnapping surfaced on Tuesday, this time in the village of Warade, where residents say at least 8 girls aged between 12 and 15 were taken on Sunday night. Let's look at the CFI report for more on that.